Hello, everyone. So, this is going to be the start to a new series. As I said on the community tab, I'm still going to be covering the LGBTQIA plus issues and stuff like that, but I'm going to be starting this one with aging and elderly care. There's a lot to it. It's something that I've actually been researching for, oh my gosh, I want to say like 7 years. But I've never really just taken the time to collect all the information and put it out there. So that's what I'm going to be doing with this. We're going to be covering things like what to expect when aging, which will be this video, and the signs to look for abuse from facilities, from healthcare providers, family members, the statistics behind things that happen with the elderly, just a bunch of random things that all have importance and need to be talked about. And at the end of this series, or sometime during, depending, if anybody has a story that they want to tell about, a grandparent being abused in a facility, or things that they did to help somebody that's elderly have a better, more functioning life, like, spending time with grandparents and doing puzzles or working in the garden or anything just to give them joy, any ideas that anybody wants to share, so that everybody can take into consideration that the fact that people get old, it doesn't mean that they give up on life. And that's a big part of what this series is going to be. But there will be some tough videos when I get into the elder abuse and taking advantages of them, as well as some scams and stuff that keep occurring and reoccurring around the elderly. But in this video, we're going to talk a little bit about aging and what to expect. And I know that, once I hit 40, it was like, oh my God, like, my son asked me if I had moved past ancient and was now considered a fossil when I hit, like, I think I was like 20, no, like 32, 33 when that happened. So just because some of us are not considered to be elderly, some of the younger generations, at 30 and 40 years old, they view us as elderly. And some people at 70 and 80, they don't consider themselves elderly. It's just all what the mind perceives, and each individual is different. So I will never say that, you're a senior citizen once you hit 65. I know there's this one lady that works up at Brahms, and she literally like runs the whole place day and night. She's always there. She's like 84 years old. And not a day goes by that she isn't there, like, getting onto them younger ones and telling them how to do it. And, age-wise, yes, she's elderly. But I personally do not really view her as elderly. And if anybody ever told her that she was getting on up there in age, she'd probably smack them with a spatula. But anyway, okay. So back to this video. What to expect with aging. Now, this is information that comes from the Mayo Clinic. And from the research that I have done on other things, The Mayo Clinic seems to be pretty good with their information and the studies that they do put out. So you know that aging will likely cause wrinkles and gray hair. But do you know how aging will affect your teeth, your heart, even the sexuality? Your cardiovascular system is one thing that worries a lot of people when they hear about the elderly. Doctors are always checking the heart functions, blood pressure, different things like that. Because the most common change in the cardiovascular system is stiffening of the blood vessels and arteries. And this causes your heart to work harder to pump blood through them. The heart muscles change to adjust to be increased. They adjust to the increased workload. Okay, apparently I'm having trouble with English today. Your heart rate as at rest will stay about the same, but it won't increase during activities as much as it used to. These changes increase the risk of high blood pressure or hypertension and other cardiovascular problems. So, a little bit about what you can do to promote heart health. You can include physical activity in your daily routine. Try walking or swimming or other activities that you enjoy. Regular, moderate physical activity can help you maintain a healthy weight and lower your heart disease risk. You can eat a healthy diet. You can choose vegetables, fruits, and whole grains with high fiber foods and lean sources of protein such as fish. Limit foods high in saturated fat and salt. And don't smoke. I'm a smoker. I'm not going to ever tell anybody to put down a cigarette. But, health speaking, smoking contributes to the hardening of your arteries and increases your blood pressure and heart rate. If you smoke or use other tobacco products, ask the doctor to help you quit. If you want to. Okay. You can manage stress. Stress can take a toll on your heart. Take steps to reduce stress, such as meditation, exercise, or talk therapy. And you can get enough sleep. Quality sleep plays an important role in the healing and repair of your heart and blood vessels. Aim for 7 to 9 hours at night. And another aspect of aging is your bones and joints and muscles. With age, bones tend to shrink in size and density, weakening them and making them more susceptible to fracture. You might even become a bit shorter. Muscles generally lose strength, endurance, and flexibility, factors that can affect your coordination, stability, and balance. And what you can do to promote bone, joint, and muscle health is get adequate amounts of calcium. The National Academy of Science, Engineering, and Medicine recommends at least 1,000 milligrams of calcium daily for adults. The recommendation increases to 1,200 milligrams daily for women age 51 and older and men age 71 and older. Dietary sources of calcium include dairy products, broccoli, kale, salmon, and tofu. If you find it difficult to get enough calcium from your diet, ask your doctor about calcium supplements. And getting adequate amounts of vitamin D. The recommended daily intake of vitamin D is 600 international units for adults up to age 70 and 800 IU for adults over 70. Many people get adequate amounts of vitamin D from sunlight. Other sources include tuna, salmon, eggs, vitamin D fortified milk, and vitamin D supplements. You can include physical activity in your daily routine. Weight-bearing exercises such as walking, jogging, tennis, climbing stairs, and weight training can help you build strong bones and slow bone loss. You can avoid substance abuse. Avoid smoking and limit alcoholic drinks. Ask your doctor about how much alcohol might be safe for your age, sex, and general health. Another thing is your digestive system. Age-related structural changes in the large intestine can result in more constipation in older adults. Other contributing factors include a lack of exercise, not drinking enough fluids, and a low-fiber diet. Medications such as diuretics and iron supplements and certain medical conditions such as diabetes also might contribute to constipation. So what you can do to prevent it. Eat a healthy diet. Make sure your diet includes high fiber foods such as fruit, vegetables, and whole grains. Limit high fat meats, dairy products, and sweets, which might cause constipation. Drink plenty of water and other fluids. You can include physical activity in your daily routine. Regular physical activities can help prevent constipation. And don't ignore the urge to have a bowel movement. Holding in the bowel movement for too long can cause constipation. Now, on a side note from that, some people need the dairy products for the vitamin D. And yes, dairy can cause constipation. But from my experience with my children when they were on formula, putting a little bit of the clear Karo syrup in the bottle with the formula helped make their stools soft. And as my children got older, and some of my elderly patients that I have taken care of through the home health, whenever they would have their glass of milk with their breakfast or whatever, I would include a couple teaspoons of the Karo syrup. And that helped. One of my clients also used to use the Karo syrup in her milk when she would have cereal. And she was pretty regular. Like, she was the one client, she had done that for years, and that was the one client that I never had to make a phone call to the nurses or anything over constipation issues. So a little bit of Karo syrup in the milk actually does help. And it's cheap. So then your bladder and urinary tract. Your bladder may become less elastic as you age, resulting in the need to urinate more often. Weakening of bladder muscles and pelvic floor muscles may make it difficult for you to empty your bladder completely or cause you to lose bladder control, which is known as urinary incontinence. In men, an enlarged or inflamed prostate can also cause difficult emptying the bladder and incontinence. Other factors that contribute to incontinence include being overweight, nerve damage from diabetes, certain medications, and caffeine or alcohol consumption. And what you can do to promote bladder and urinary tract health. Go to the toilet regularly. Consider urinating on a regular schedule, such as every hour. Slowly extend the amount of time between your toilet trips. Maintain a healthy weight. If you're overweight, lose excess pounds. Don't smoke. If you smoke or you use other tobacco products, ask your doctor for help to quit. Do Kegel exercises. To exercise your pelvic floor muscles, known as the Kegel exercises, squeeze the muscles you would use to stop passing gas. Try it for 3 seconds at a time, and then relax for a count of 3. Work up to doing the exercise 10 to 15 times in a row, at least 3 times a day. Avoid bladder irritants. Caffeine, acidic foods, alcohol, and carbonated beverages can make incontinence worse. Avoid constipation. Eat more fiber and take other steps to avoid constipation, which can worsen incontinence. Your memory and thinking skills. Your brain undergoes changes as you age that may have minor effects on your memory or thinking skills. For example, healthy older adults might forget familiar names or words, or they may find it more difficult to multitask. And I'm not really speaking of like Alzheimer's here. I'm talking about just normal, everyday, forgetting where you put your keys or stuff like that. You can promote cognitive health by taking the following steps. Include physical activity in your daily routine. Physical activity increases blood flow to your whole body, including your brain. Studies suggest regular exercise is associated with better brain function and reduces stress and depression factors that affect memory. Eat a healthy diet. A heart-healthy diet may benefit your brain. Focus on fruits, vegetables, and whole grains. Choose low-fat protein sources such as fish, lean meat, and skinless poultry. To use too much alcohol may lead to confusion and memory loss. Stay mentally active. Staying mentally active may help sustain your memory and thinking skills. You can read, play word games, take up a new hobby, take classes, or learn to play an instrument. Be social. Social interaction helps ward off depression and stress, which can contribute to memory loss. You might volunteer at a local school or nonprofit, spend time with family and friends, or attend social events. Treat cardiovascular disease. Follow your doctor's recommendation to manage cardiovascular risk factors, high blood pressure, high cholesterol, and diabetes. They may increase the risk of cognitive decline. And quit smoking. If you smoke, quitting smoking may help your cognitive health. If you are concerned about memory loss or other changes in your thinking skills, make sure to talk to the doctor. Your eyes and ears. What's happening with age? You might have difficulty focusing on objects that are close up. You might become more sensitive to glare and have trouble adapting to different levels of light. Aging also can affect your eye's lens, causing clouded vision, known as cataracts. Your hearing might also diminish. You might have difficulty hearing high frequencies or following a conversation in a crowded room. To promote eye and ear health, you can schedule regular checkups. Follow your doctor's advice about glasses, contact lenses, hearing aids, and other corrective devices. You can take precautions. Wearing sunglasses or a wide-brimmed hat when you're outdoors, and use earplugs when you're around loud machinery or other noises. Your teeth. Your gums might pull back from your teeth. Certain medications, such as those that treat allergies, asthma, high blood pressure, and high cholesterol, also can cause dry mouth. As a result, your teeth and gums might become slightly more vulnerable to decay and infection. To promote oral health, you can brush and floss. Brush your teeth twice a day and clean between your teeth using regular dental floss or an interdental cleaner once a day. Schedule regular checkups. Visit your dentist or dental hygienist for regular dental checkups. Your skin. With age, your skin bends and becomes less elastic and more fragile. The fatty tissue just below the skin decreases. You might notice that you bruise more easily. Decreased production of natural oils might make your skin drier. Wrinkles, age spots, and small growths called skin tags are more common. To promote healthy skin, be gentle. Bathe or shower in warm, not hot water. Use mild soap and moisturizer. Take precautions. When you're outdoors, use sunscreen and wear protective clothing. Check your skin regularly and report changes to your doctor. Don't smoke. If you smoke or use other tobacco products, ask your doctor to help you quit. Smoking contributes to skin damage, such as wrinkling. Your weight. How your body burns calories, the metabolism, slows down as you age. If you decrease activities as you age, but continue to eat the same as usual, you'll gain weight. To maintain a healthy weight, stay active and eat healthy. What you can do to maintain a healthy weight. Include physical activity in your daily routine. Regular, moderate physical activity can help you maintain a healthy weight. Eat a regular diet. Choose vegetables, fruits, whole grains, high fiber foods, and lean sources of protein such as fish. Limit sugar and foods high in saturated fat. And watch your portion sizes. To cut calories, keep an eye on the portion sizes. Your sexuality. With age, sexual needs and performances might change. Illness or medications might affect your ability to enjoy sex. For women, vaginal dryness can make sex uncomfortable. For men, impotence might become a concern. It might take longer to get an erection, and erections might not be as firm as they used to be. But what you can do to promote your sexual health. Share your needs and concerns with your partner. You might find the physical intimacy without intercourse is right for you, or you may experiment with different sexual activities. Get regular exercise. Exercise improves the release of sexual hormones, cardiovascular health, flexibility, mood, and self-image, all factors that contribute to good sex health. And talk to your doctor. Your doctor might offer specific treatment suggestions such as estrogen cream for vaginal dryness or oral medication for erectile dysfunction in men. You can't stop the aging process, but you can make choices that improve your ability to maintain an active life, to do the things that you enjoy, and to spend time with loved ones. Okay, so that sums up for this video. Have a good day, everybody.